Hello everyone and welcome. Thank you for taking the time to view this training exercise on de-escalation techniques. My name is Pablo Savoldi and today we are going to highlight different modules that talk about how important it is to ensure that we are de-escalating every situation with our students. So let's go ahead and get started. Welcome to Module 1. In this module, we are going to review the crisis model, we're going to look into a case study, and then we'll have a brief knowledge check all the way at the very end. That all behavior is a form of communication. Whenever we see students walking in through our doors early in the morning and they're feeling a certain type of way, we know that they are trying to communicate to us even though they're not able to verbalize it. So it is very important that through the course of this presentation, we keep in mind that the behavior that students are exhibiting is in fact a way that they're trying to communicate something to us even though they cannot physically verbalize what they are trying or what they are feeling. And so the CPI values and philosophy, today we're going to cover four main ones. So care, welfare, safety, and security. Of course, we'll talk about respect, dignity, empathy, and this presentation itself being person-centered. We'll go into maintaining independence, choice, and well-being. We'll talk about protecting rights and minimizing harm. And of course, we'll cover safe, effective, harmonious, and collaborative relationships. So the CPI crisis development model. The CPI crisis development model is very much an integrated experience. So we see on the right-hand side there, staff attitudes and approaches, and on the left-hand side, anxiety. Okay, so the very first one, anxiety, is a change in typical behavior. We know this to be true. We sometimes see it in our students, and in fact, we often feel it ourselves. So whenever that is being portrayed, anxiety, our staff attitudes and approaches should be very much a supportive stance, right? An empathic, non-judgmental approach. Whenever students are feeling defensive, right, protecting oneself from a real or perceived challenge, we definitely need to be a little more directive, right, providing clear direction or instruction when it comes to de-escalating the situation. Of course, there's behavior that presents an imminent or immediate risk to self or others. Our job is safety as being the safety interventionists, non-restrictive and restrictive strategies to maximize safety and minimize harm. And of course, tension reduction. This, of course, comes last, is a decrease in physical and emotional energy after we have gone through the periods of anxiety, defensive behavior, risk behavior. So now we go into the tension reduction portion, and our job is very much a therapeutic report to reestablish the relationship that the student himself or herself feels that has been damaged through the course of them feeling a certain type of way, and our job as educators is to de-escalate that situation. That, of course, is the integrated experience model. And so, a very quick case study. A parent waits to meet with her son's teacher. This is the third time in a month she's been called into the office regarding her son's performance. She's a single mother working 2 jobs and had to take time off work to be here. She's pacing, fidgeting with her phone, and constantly asking the school secretary where the teacher is. When the teacher arrives, the parent yells at her for wasting her time when she should be at work. When asked to work with her son to complete supplemental worksheets to help him improve his math scores, she argues, "I don't have time for this. Isn't this your job?" Right? And so activity questions. What behaviors, level of crisis did you see? What staff approach would you take to this? And what would you say, or what would you do? Of course, at the end of the presentation, there are questions that you would have to answer. So please refer back to the case study and also the bullet points that we are highlighting. And we'll do this throughout the course of the presentation. So, a very quick knowledge check. When an individual is demonstrating behaviors such as kicking and biting, they are displaying anxiety, defensive, risk behavior, or tension reduction. And yes, it is in fact risk behavior. An individual is looking at the clock and pacing back and forth. What behavior level is the person exhibiting? Anxiety, defensive, risk behavior, or tension reduction? Yes, it is anxiety. How would you respond to help an individual who is saying no and refusing to perform a task? Supportive words and attitude, call for help, provide choices with consequences, or reestablish the relationship right away? Yes, provide choices with consequences. Final thoughts on this. We're going to go ahead and review the points to remember and reflect on your key takeaways from the module. Now remember, at the very end of the presentation, we do have questions that is going to be part of a summative knowledge check. So please remember to check back to the video to take away those points. Module 2 focuses on the integrated experience, rational detachment, and precipitating factors. And remember, your approach to the situation determines the entire outcome. Module 2, the integrated experience. So, as I said before, your approach changes everything. How you approach a situation whenever a student is not in the best state really does determine the outcome of that situation. If you are coming to that situation already heated, if you are coming to that situation and your stance is not what the student is able to receive, and we're going to cover that later on, that is going to affect how that student is going to communicate with you. So remember, before you approach the situation, before you even get to the de-escalation portion, how you approach the situation has 100% of the chances of that outcome being either positive or negative. And so the CPI crisis development model, we have gone through this already in the previous module, so it's a very quick review. So we are going to talk about how behavior influences behavior, and that is part of the integrated experience. What are factors that might negatively impact your ability to remain consistent and calm in your response? Now let's see, it's a Monday morning, you're just coming in, there was traffic, you're 15 minutes late. As soon as you get to campus, two students already need your help. There might have been an issue on the bus. Probably you woke up late, and so all these things that are already building up inside of us does have an effect into how we approach situations that might be waiting for us on campus as soon as we get there. And so whether it be trying to fit too much into one day throughout the day, interpersonal conflicts at work, some sort of family stress, illness, not enough sleep, so on and so forth, these are things that can negatively affect how we approach situations and our abilities as educators on how we de-escalate situations that arise on campus. And so precipitating factors that influence behaviors. Understanding precipitating factors helps you to avoid becoming a precipitating factor yourself, address the factors that lead to crisis situations, and not take crisis personally. And I cannot stress that last point enough. Whatever happens on campus, it's not about you, right? Sometimes, unfortunately, there are students that come to campus and they are dealing with a lot in their personal lives, and it's our job to be there and be sympathetic and be empathetic. And so it is really, really crucial when it comes to de-escalation that we do not take these crises personally, as they are not about us. It is just a form of students trying to communicate with us how they feel in the best way that they know how. And sometimes that best way is not verbally, sometimes it might be physically. So we'll talk about how to keep yourself and others safe at that point. Rational detachment. So recognizing the need to remain professional by managing your own behavior and attitude. Observe the behavior. What is the other person communicating? How are you responding? What are you expressing or conveying? And how are they responding to you? Some tips: take a deep breath, choose your words carefully, and ask for help. Remember, you are never alone. An administrator is a call away. As we know, the integrated experience, what we know about students' lives and what they are coming in that morning is shown. What we do not know is usually a lot more than what we do know, unless we already have a relationship with that student. We know the details of their lives. Their parents have told us a thing or two. The student has shared. They have spoken with a counselor. But for the most part, what we know from that student is really the tip of the iceberg, and the unknown is everything else that is causing that behavior to be exhibited. So, which of the following best describes rational detachment? Is it the underlying reason for behavior, a staff response to calm someone, or maintaining your professionalism by not taking it personally? Yes, it is maintaining your professionalism by not taking it personally. Remember, these questions are going to be at the end of the presentation, so make sure you are jotting these down for the knowledge check all the way at the very end. The integrated experience means that change happens when you can control the behavior, behavior influences behavior, or you should always match the other person's behavior. It is B. Behavior influences behavior. We should never try to match the other person's behavior, because then again, we are not de-escalating the situation. We are escalating it at that point. Precipitating factors is a concept that refers to the underlying reasons for behavior, an empathic, non-judgmental approach, postures, gestures, facial expressions, and movement used to communicate. It is the underlying reason for behavior, yes. What do we not know about the behavior that the student is trying to communicate to us? And of course, also, what do we know about that same behavior? Our final thoughts on this module. Review the points to remember and reflect on your key takeaways from the module itself. And remember, these questions are also going to be brought at the very end for the summative knowledge check. In Module 3, we'll talk about communication skills, proximity, and how to listen with empathy. At the very end, we'll have a very short knowledge check. Communication skills. We've already talked about the CPI crisis development model. Of course, this is the integrated experience. We have the crisis development behavior levels to the left and the staff attitudes and approaches to the right. We have anxiety equals with supportive, defensive, we should be directive. When there is behavior that is risky, our job is to be safety interventionists. And then the very last, attention reduction, we go into the therapeutic report. So forms of communication, we have verbal, paraverbal, and non-verbal. Communication considerations, we have culture, gender identity, age, and cognitive functioning. How would you alter your communication when considering these factors? What about your posture or even your gestures? How do we communicate with certain cultures? How do we communicate with those with different gender identity? How do we communicate with those who are different age, whether they be younger or older? And also, do we realize the cognitive functioning of the students that we are communicating with, and we are trying to de-escalate the situation that they are involved in? So all of these are very important takeaways to consider whenever we are handling a situation, and how we approach that situation, how we approach that behavior is critical as to how the conclusion will be, whether it be positive or whether it be negative. Keeping these 4 factors in mind is very, very critical. Verbal communication. So it should be short, simple, and clear. It should be respectful, and it should be positively phrased at all times. So instead of, "You are not supposed to be in this area," maybe we can say, "You seem lost. How may I help you?" Right? Immediately, you are not coming off like you're trying to blame somebody for something. You're not trying to tell a student that they should not be where they are supposed to be. Instead, you know that is already the case, but you are approaching the situation differently by asking a question. So you're opening the line of communication between you and that student. Paraverbal communication, your tone, your volume, and your rhythm of speech. And one thing that I always say at trainings is that we don't necessarily have to increase the volume of our speech in order to convey a point and students understand that we are being serious. Volume really doesn't do a lot whenever we are trying to get our point across. However, we can maintain the same volume. It could be a very low level volume or normal for that fact. But if we do change our tone with it, that actually gets you a lot more bang for your buck, right? Students understand tone, and they recognize tone a lot faster than they recognize volume, because with volume they already know that you are angry, and that line of communication is not really it's not there. It's already broken before it started. And so with tone, something that I tell those that we train as a team is that tone is a lot more effective than raising your volume and also your rhythm of speech. And so use caring, supportive tones, keep the volume appropriate to the situation, and deliver your message at a rate the person can process. Don't blurt it out very quickly, don't whisper it very slowly, but deliver the message at a rate that the person can process it, and that open line of communication is being built. And so nonverbal communication, now we're talking about personal space. We're talking about body language, communication through touch, and listening with empathy. How are we approaching somebody through their personal space? What body language are we conveying? Are we arching forward? Are we leaning back? Are we approaching them with our shoulders squared? Are we approaching them from the side? Are we lightly putting our hand, maybe on their shoulder or on their back if they're feeling a certain type of way? Are we listening to how they are feeling at that time? Pop question. Personal space is the posture, gestures, facial expressions, and movement used to communicate, a form of physical contact that expresses feelings or emotion, the distance people prefer to maintain between themselves and others. And correct, it is C. The distance people prefer to maintain between themselves and others. Some students really, really like their personal space. If you're working in primary or elementary, that personal space doesn't really exist as much as it would maybe in middle or in high school, right? Because they always want to be next to you, and that is the way that they are conveying their need for support. Social zone, just a graphic here. So that is the social zone between you and somebody else. This will be the personal zone. Okay, now we're having a conversation, and this will be a little too close, right? That intimate zone. As I said before, if you are working in primary or elementary, you're very much used to seeing students a lot more in your intimate zone, and as we go into the secondary levels, right, it's more of that social, that personal zone. None of them are bad, but you have different ones that convey a different message, and different students respond to different zones differently. So it is your job as an educator, especially when it comes time to de-escalate a situation, that we understand what zone, if we know that student is most comfortable with. Pop question. Body language is the postures, gestures, facial expressions, and movement used to communicate, a form of physical contact that expresses feelings or emotion, the distance people prefer to maintain between themselves and others. Yes, it is the postures, gestures, facial expressions, and movement used to communicate. Communication skills. When someone is anxious or defensive, how may their body language communicate this? Might they have their arms crossed? They're probably avoiding eye contact. Are they slouching? Maybe they're faking a smile, angling their body away towards you. Maybe they're wringing their hands. So all of these could be examples of how somebody looks whenever they're anxious or defensive. Communication through touch is the postures, gestures, facial expressions, and movement used to communicate, a form of physical contact that expresses feelings or emotion, the distance people prefer to maintain between themselves and others. Yes, it is a form of physical contact that expresses feelings or emotion. Communication through touch. Here we have examples of what that might look like, or what that student is comfortable with receiving. In the supportive stance, of course, the position, posture, and proximity, these are all critical in how we approach a situation that we are trying to de-escalate. So, communicates respect, appears non-threatening, and maximizes safety. As you see, she is slanted, her shoulders are not square, one foot is in front of the other, and she is maintaining eye contact with the other person. The last point of being maximizes safety is if you turn to the side, that of course makes you a smaller target in case the student does happen to get something in their hands. We are not standing with our shoulders square, and it would be a lot easier for them if they are causing harm to themselves or to others. It would be a lot easier for them to do that to anybody that might be standing in front of them. As opposed to standing with your shoulders kind of apart from the other person, sort of perpendicular, that would be a lot more helpful to the person in front of that student. Listening with empathy, remaining non-judgmental, give your undivided attention, listen to facts and feelings, allow time for silence and reflection, and paraphrase what you understand whenever we are listening to a student that is sharing how they are feeling. Listening with empathy is giving judgments and advice, a way of listening and responding to other persons that improves mutual understanding and trust, and managing your approach in relation to the person. And yes, it is B, a way of listening and responding to another person that improves mutual understanding and trust. Now let's check. Which is a nonverbal supportive response to a person in distress? Limit setting, respecting personal space, or downplaying the challenge? Yes, it is respecting personal space. Which of the following is a paraverbal way of demonstrating your support? Your word choice, your body language, or your tone of voice? Yes, it is your tone of voice. It's a lot more effective than volume. When demonstrating the supportive stance, think about your position, posture, and power, proximity, personhood. Yes, it is definitely proximity.